what they did with the grant that they received from Giving Women. And then they're going to wrap up their discussion with the impact, if there's been any impact of COVID to their organization. We're going to start with Breaking Free first, then we will move to St. David's. And I do have time on the agenda for questions after each presentation and also at the end. So let's go ahead and get started. Our first grantee is Breaking Free. If you spent any time on their website, you will notice that they have I was going to say a simple mission, but Terry probably would not say it's a simple mission, or vision, I should say. Their vision is to end all forms of sex trafficking and prostitution. So that is not a simple vision, obviously, but that is what their vision is. And in 2019, Giving Women granted Breaking Free $35,000 to support their general operating expenses. So I'm going to turn the floor over to Terry Ferliti. Terry is their executive director, and she's here tonight to share the Breaking Free story. So Terry, I will put myself on mute and you go ahead and take it over.
Thank you, Jody. And many of you look extremely familiar, so I know I've met you before, and you may or may not remember, I'm a survivor leader. We are a survivor-led organization, and most of my staff are survivors as well. That's not easy. It's not an easy task. It'd be far easier to go out and hire folks that were social workers, whatever, but that's not who we are, and we wouldn't be as effective with helping the women that we help. Each year we see about 200 to 300 new women, in addition to those that we've been serving for many, many years. Some of our women have been with Breaking Free for 25 years next year we've been around. And they keep coming back because I'm sure that many of you can understand that when you're in the life of prostitution and you have been exploited for much of your life, you miss that peer development. You miss a lot of building relationships with other people.
I have the bows on, that's why.
Somebody isn't muted. I think Pam Albright. But anyway, if you can still hear me out.
Mary, is there any way that you could mute that call?
There we go.
There you go.
Okay, so yeah, our job is to help end sexual exploitation, sex trafficking, human trafficking, whatever you want to call it. It goes by a lot of different terms, but bottom line, what it is that someone buying another person for their self-gratification, for their sexual gratification, and it's not okay. And you might think, well, obviously it's not okay, but that's not the climate around the world anymore. There's a lot of folks that say, no, I think this is okay. I can pick and choose if I want to have sex, and it's not hurting anybody, so be quiet, and we're not going to have any legislation regarding this. Well, that's a bunch of BS. First of all, there's nobody in their right mind would want to have sex with somebody 5 to 10 times a day, even if it was your spouse. Come on. And how, I'm sorry, but it's just such a no-brainer to me, you know, that this is violence against women. So we do have a big fight. I work every Friday. I'm on Capitol Hill in Washington, D.C. with Shared Hope International talking about the Earn It Act. I work with CAP International out of Paris, France once a month, and we talk about things that are going on in 38 different countries. Plus in the United States, we have to do this 50 times, everybody. 50 times we have to pass legislation for each state. So in our state now, we have the Safe Harbor for All, which means, you know, anyone who's 18 and under can't get arrested, but now I'm going way off track. So anyway, that's just a little bit of history about the climate of where we're at right now. So I just want to thank you for being interested, and I want to thank you for being aware and recognizing this as violence against women. So what we did with the money, a safe emergency shelter, September 1st of 2019. There are 0 shelters in the state of Minnesota that are dedicated to women who are women and children that are sexually exploited. There's a lot of domestic shelters, but they're funded to handle domestic violence survivors. So I have to respect that. And if they do have an opening, they'll go there. But so we opened up a 4-bedroom facility where folks anywhere from 18 to however old are right now. I think our oldest client is 64, for any age, and they can stay as long as it's kind of a gap. So most of the women that come to us have no ID, no birth certificate, no kinds of any kind of documentation, because that's what exploiters use to keep us in the life. So the first thing we do is work on a safety plan. Then we work on getting them their documents. And then we talk about whether or not they, want to be, if they can be reconciled with their children, their doctor visits, things like that. It takes a while before we even get to the job part or the education piece, because quite frankly, ladies, many of us have congenital anomalies or pre-existing conditions before we get into life. So we're either fetal alcohol syndrome, we could be autistic, we could have multiple personality disorders, because that's what a perpetrator is looking for to groom us. So many of us, once we get out, we're stuck with all that as well. So we have to work through a lot of layers at this transitional house. So I can't say, when we first were going to open it up, we thought, okay, this is going to be a 2-week stay, 3-week stay, maybe 4 weeks. That's not in reality what happened. So sometimes some of our women can be up there, our girls can be there for, up to a couple months before we can find safe housing for them. Because the number one barrier into getting out of the life of prostitution is a safe place to go. Where are you going to go tonight if you don't have somewhere safe? You're going to go back to the street. You're going to go to your perpetrator. It's just as simple as that. So we were able to open up that house. Everybody thought I was nuts because we didn't really have funding besides yours. And then Safe Harbor gave us a grant for $45,000 per year. And now we're just growing. And I spend a lot of time writing different grants to keep that going, because we've been at capacity since day one. So thank you to every one of you for helping build that opportunity, because if it wasn't for you and for Safe Harbor, we wouldn't have that space today. And we do. So we really appreciate that very much. And over the last year, I think we've had 58 different people that we've been able to serve in that space. So that's wonderful. And we continue to keep working on that. COVID. How did COVID impact us? Other than myself having COVID the first week of April and spending a week in the hospital, not too many, only one other staff had COVID, and none of our clients have had COVID. Thank God, and which is a complete miracle in itself, because we house 54 different families. Nobody in our permanent housing has had COVID that we know of. Many of them may have had it and didn't get tested, because quite frankly, our folks aren't worried about COVID. They're worried about how they're going to get through today. They're worried about what are they going to eat? Are their kids safe? Is their baby daddy going to come over and beat them? Do they have enough money to pay their bills? COVID is not a thing. What they are concerned about, however, is why aren't our kids in school? We need our kids back in school. Many of our kids, including my own, have special needs. They're not going to get them. I'm a single mom. I'm at work every day. How is my kid going to get her special needs met? Luckily, she graduated high school, which was horrible this year. But so she's out. But most of my clients, most of my staff's not as old as I am. They have little kids. And that's what affects us the most. What's happening with our children? We do use safety measures, and we do provide all of our clients with masks, with disinfectant, with even toilet paper and paper towels, and we call them COVID kits, and food and whatever. But more than not, what really impacted everybody was basically the George Floyd death, because most of our women are women of color, and we're on University Avenue. So of course it impacted us. There was violence, we were shot at. So that's the kind of stuff, really, the kind of the overarching. It got kind of, COVID kind of took a back chair to all that. And that's what we're working with right now with our folks, is just trying to engage in community action, getting people to vote, getting people to voice their opinions in different formats, things like that, and just to be safe. That really is what kind of overtook everything. I'm getting tongue-tied and twisted right now. But so the COVID, I'm very concerned about COVID, because especially with these recent spikes, what if my safe house, someone gets COVID? We were going to have to get hotel rooms for every one of those women. Okay, good. We're going to have to get hotel rooms for every one of those women that in the safe house. And we did get some extra COVID money, so we are able to do some of that. But we still, and working in the encampments, a lot of our girls lost jobs. So some of the gals that were in shelters like Dorothy Day or Higher Ground or things like that, where it was just the day-to-day shelter, ended up in the encampments. So that's the other thing I forgot to mention. It's very key. So we spent a lot of time at those encampments, at 19 of them in St. Paul and 17 of them in Minneapolis. So yeah, COVID is, it worries me more than it worries the clients. I'm just very, very nervous that once it takes, it's gonna, boom, affect a lot of our gals. But so far we've been lucky. I mean, I can't even believe we've been as lucky as we have been. So knock on wood. But thanks again to every one of you wonderful women that you really opened up a service that you're making history, really. I mean, we haven't had this kind of opportunity in Minnesota before. And I just thank you for everything that you've done and how you've helped us out over the last couple of years. I really
Carrie, thank you. Thank you. I appreciate the overview. I have a little dog behind me that knows that I have food up on my desk here, so she's going to bark any minute. So does anybody have, I have just a couple minutes here for maybe 1 or 2 questions for Terry. Does anybody have any questions for Terry for breaking free? Otherwise, we will have time at the end as well. And if you do have a question, please maybe just wave your hand at me or take yourself off of mute. It's a quiet group. So I guess I was going to ask the question about, capacity, but you actually already answered that, where I heard you say that it opened in September of 2019 and there can be 4 residents and you've already had 58 people served and you were at capacity since day 1. That's amazing as far as the need. So with some of the women that come to that shelter, you mentioned children and you mentioned some of your permanent housing as well. How are they dealing with distance learning for their children?
Well, we have a lot of distance learning services that we can provide. Even though we have those services available, not many take us up on it. So we have case management at our 2 18-unit apartment buildings. We also have another 12 families that have Section 8 certificates. And then we have what's called a Hearth Connection, which is 7 more families. So there's about 20 families or so that we can't really reach on a day-to-day basis, but those that are in our permanent supportive housing that are side by side, we do check with the moms at least once a week to see if they need help. We also can provide tutors, one-on-one tutors for reading and just for navigating, the distance learning, because it's difficult. But my guess is that when we leave, that kind of falls by the wayside. I don't know. I mean, we do the best we can. I just hope that the schools open sometime soon, because there's just, oh my gosh. I did go to the building a couple weeks ago and I saw half of the kids at the playground and I thought, well, maybe this is recess. That's great. And was hoping that because they still need that. But my feeling is no, they're probably going to be out there for many, many hours, but we do the best that we can to encourage the distance learning.
Terry, I had a question come in that we'll answer this question and then we can move on then to St. David's. And then, like I said, we've got more time at the end. But a question that came in that just said, what changes have you seen in the past 2 years? You know, any positivity or new resources being offered to help?
Oh, absolutely. Well, because we had, in the last 2 years, we've opened up so many more services than we have before by having our drop-in center and the emergency shelter. So let's say one of the camps, Powderhorn Park, you probably all have heard about that. There was at one time 200 tents there, right? Well, then they had a moratorium and now there's only 25 tents that can be at any particular park. So what we did was we created a new space called Brackett's Park, where we just brought women and children there. So it was just a women and children encampment. So we were able to bring them to our facility and let them take showers, change clothes, get sleeping bags, even tents, different food, hygiene, a lot of different things that we have at our center now because we have that extra space that was provided, you know, largely because of y'all. So we have that extra space. We have that capability. We can also, we added laundry, which is a big thing, which is huge for a lot of folks. They don't wash their clothes, you know, they just discard them generally, but we'll do laundry and we can offer so many more services because we have that space. That's one of the things. The second thing is that more people know about us because we've been able to do more outreach because of the facilities that we have, the opportunities that we have to bring folks to the shelter and to our drop-in. So more and more people are finding out that there is a way out of this, that this is not what you're destined for the rest of your life. There is a way out. It's tough. It can be done, and we're here to help.
Sorry, there we go. Well, thank you. Thank you. Very inspirational. And it's, thank you for all the work that you do to support those individuals. Yes, like Diane said, cheers. We will have, like I said, we'll have some extra time at the end for any questions. Let's go ahead then and just move to our second grantee, which is St. David's Center for Child and Family Development. St. David's is about making an impact. They're an exceptional preschool, children's mental health clinic, and pediatric therapy clinic, and they're all under one roof. In 2019, Giving Women granted St. David's $10,000 to support the Harmon Center. So I'm pleased to introduce two guests today from St. David's, Maureen Walsh, who is the Chief Advancement and Strategy Officer. Do you maybe want to wave, Maureen? There we go. And then also Lisa Brenham. Lisa Brenham is the Senior Director of the Harmon Center. Where did she go? There she is on my top right. The two of them are here to share their story. So Maureen and Lisa, I'll turn it over to you.
Thanks, Jody. And thanks to everybody for spending the hour together tonight, echoing Terry's gratitude. And I think, you know, just being in fundraising for the last 20 years, I think there are people that write incredibly generous checks and they make a big difference. And there are people that write generous checks and want to lean in to learn more. And they stay curious and they wanna feel connected to the impact in a more personal way. And so I just want to thank you for being those people in the world. Better to be in relationship with you, I would say, than folks that only write checks. So with a little bit of bias said. So St. David's Center, I'd like to give just a couple-minute overview and then pass it to Lisa Brenham. She's our Senior Director of the Harmon Center for Child and Family Wellbeing downtown, and we'll speak to a little bit more to the topic of how we use the grant funds to support our work there. So St. David's Center is 60 years old next year. We are a large multi-service organization, child and family services organization, serving about 4,200, under normal circumstances, serving about 4,200 children and families across the Twin Cities metro. Our namesake is St. David's Episcopal Church in Minnetonka. We bought the building across the street, an old Hopkins public school building, in 1989, and basically continued to grow our services in the West Metro for about our first 25 years. About 30 years ago, we started serving more and more families throughout the metro through in-home and community-based partnerships. And in 2010, when our current CEO became the leader of the organization, our board made a very active decision to grow our reach through partnerships. And I'll tell you about a really important partnership in about 45 seconds. So our services, as Jody talked about briefly in introducing us, consist of 3 core service areas. So the first is our inclusive early childhood education program. We remain the largest inclusive program in the state of Minnesota. So that's kids with special needs sitting in the same exact preschool rooms as kids with more typical development. And under normal circumstances, we serve about 330 children in that service area in a year. The second big core service area is the largest by far and is growing, actually. It's grown significantly over the last 25 years, and that's our early intervention set of services. And that's, you'll hear Lisa talk a lot about our services at the Harmon Center. That's some of where that growth has happened. And then the third core service area is support to children and adults with enduring special needs. So for some children, they grow into adulthood and their needs will be with them for a lifetime. Our organization has built those relationships with families where they don't quite want to let go. It's kind of like Terry was describing her families, her women, some of the women that are involved with Breaking Free too. Once you feel that support, it's hard to let go of that when you need it, still need it in your day-to-day living. So that's our organization as a whole. We have 2 campuses, one in downtown Minneapolis that Lisa's going to tell you about in just a minute, and then our campus in Minnetonka, 60,000 square feet out west. Those campuses are focused on early intervention, but then through 30 partnerships, we reach another 2,500 children and families a year. So our growth has been largely through those partnerships, in addition to the Harmon Center getting launched in March of 2018. So just one more minute of background on the Harmon Center and on the importance of our relationship with Giving Women and other support to that effort specifically. In July 2016, we opened our campus in Minnetonka, renovated and expanded the building in Minnetonka. And about a week after that, we got a call from Westminster Presbyterian Church asking us to submit a proposal for what we would do as an organization with 10,000 square feet in downtown Minneapolis. They said, we're going to give you an incredible rate on rent, just wait and see. And we had faith, and sure enough, that panned out to be $1.50 a square foot. We submitted that proposal in October of that year, so quick turnaround. And a month later, out of 30 nonprofits that they vetted, they chose St. David's Center. So we believe that we were chosen because of that focus on early intervention. Just like Terry mentioned, I mean, there are so many families in our community that for whatever circumstances, they're struggling in the parent-child relationship, they're struggling with meeting basic needs, they're struggling with systemic racism, with domestic violence, community violence, just lives that are incredibly hard, and bringing children into that kind of family life where stress already abounds, where there's lots that's been challenging from early on in their own lives, makes it that much more complicated to really make advances in your own life, to kind of fulfill your own potential. And so our dream was to build the Harmon Center for Child and Family Wellbeing, where we would enter into those families' lives when children are very, very young, so birth to 5 years old, and enter in through a set of services that Lisa will describe in just a second. She'll talk a little bit about our impact there as well. So as a result of getting chosen, we launched the Harmon Center, and there is a massive amount of need for support from organizations like Giving Women. We're incredibly grateful for that support. It 1 year into our launch, it was clear that we're going to need friends and community partners like Giving Women for years to come because of the level of needs that we're addressing there. So without further ado, Lisa's going to tell you a little bit about the services that we provide there.
Thanks everyone for listening and being here and caring and joining the call in the evening on a dark Monday night where it feels like winter. I keep thinking, is Christmas coming? I'm confused. I think Maureen, I can say right away that the need for extra dollars is because our families can't be served through a typical medical model. The families that we serve at Harmon Center can't survive off of one hour of psychotherapy a week or 1 hour of anything per week, like you know, Terry, as well, that they need more support than that. So there's a cushion there that the money can provide for us. So like Maureen said, our goal at Harmon Center is, providing really incredible, effective early intervention, specifically with families who've experienced trauma and adversity. A history of trauma can mean many things and can present itself in lots of ways. Typically, all of our clients come delayed across developmental domains. So social emotional delays or cognitive delays stemming from inconsistent or neglectful parent care, speech delays, fine and gross motor delays stemming from lack of exposure or lack of experience. Those are the kiddos and the families that we're serving at Harmon. They come to us through relationships that we're currently fostering and developing and continue to develop. Children's Developmental Peds Clinic, Minneapolis Early Childhood Screening, Hennepin County programs, other school districts, and more. And once they get there, we have a menu of services to offer and a team of people to start meeting their child's needs as well as their family's needs. So we've got several different parent-child therapy and early childhood home visiting programs where we have folks go directly into folks' homes, or we used to. We have a few that still go in home because we're their only connection, but we're doing a lot of telehealth right now. But this grant ran, I believe, through June. And so up until COVID, primarily we were providing these services in the home or at Caribou or a park or a community center, whatever felt safest to that family, sometimes during lunch. Our Family Place Mental Health Day Treatment Program serves kids who typically have a history of trauma. We serve them 5 days a week, 3 hours a day in a classroom setting. And then we also have family therapy and family skills to support the family as well. Typical length of service there is 12 to 18 months. And then we have our Autism Day Treatment Program, which is the only one in the city that focuses on our East African population. Children ages 3 to 7, 4 hours per day, they get integrated speech and occupational therapy within their Autism Day Treatment Day, and their length of service is a little bit longer, almost 24 months. So those are the three big kind of service areas, and many of our clients are receiving services, they're receiving individual therapy, speech therapy, day treatment, and then they might be receiving pre-care and post-care if they're on a wait list from any one of our clinicians in any of those programs, so that we can kind of wrap around the care for them in terms of what their needs are. During the grant period, we served 239 kids, and 85% improved significantly in their developmental functioning. Of the parents and families receiving services, 81% are demonstrating responsiveness and positive interactions with their kids. I think the services we provide are exceptional and best explained by our belief in, number one, the reparative nature of relationships, and that having a secure foundational relationship is necessary for growth and development in all areas. And number two, our capacity as an agency to provide multiple services, and as a result, multidisciplinary teaming and consultation on site. So all of our staff members who know and believe in and are serving these families work in the same office space. So our occupational therapist talks to our speech therapist, who talks to the mental health therapist, who can talk to the case manager. And it's a really nice way for a family to have kind of a one-stop shop and not have to worry that their primary care physician is going to talk to their therapist, who might be able to talk to their occupational therapist. So really being able to meet all those needs in one spot. Maureen, do you want me to kind of tee up? I don't know if you're going to talk about one of our clients or if we wanted to show that, or.
Yeah, Jody, we'd love to send a link to you if you're interested in hearing one family's story. We knew that a video tonight would, first of all, be too long, and second of all, just technology may not make that possible. But we've got a story of a little girl named Hallie, who is a really great example of the idea of coming alongside a family as they navigate moving from fostering to adopting a couple sisters. And I think it'll just show you a little bit about what the
Yeah.
services, specifically Family Place at the Harmon Center.
That would be
what their
great,
impact
Maureen.
is.
Yes,
Great.
please send me the link and I'll make sure we get that distributed to our members. Thank
Great.
you.
Awesome.
Thanks, Lisa. So let me just tell you in 1 minute, which is a hard story to tell in 1 minute. COVID has had a catastrophic effect on St. David Center. As Lisa said, our services are almost all, they are all relational in nature, and they're with very young children and very young children's parents. And so, and oftentimes very distressed families. And so imagine transitioning to telehealth with a 3-year-old and trying to engage a 3-year-old through a screen, and being a parent that is under-resourced, that struggles to connect sometimes anyway, struggles to maintain a consistent approach to their parenting, may struggle with patience, may struggle with tuning into what their child needs at any point, and then we're asking them, instead of coming to our center or us coming in their home, we're asking them to engage through a computer. So our uptake of telehealth has actually been fairly impressive. I think to date we've reached just about 900 families on a consistent basis with telehealth, which is good. We feel proud of that. We've got another 900 children and families that are being seen on one of our 2 campuses for at least 1 service a week. So that's a good number, and we have incredibly rigid protocols around safety and sanitation. We're incredibly worried about our workforce, not only the folks that come to work every day. The work is incredibly difficult right now, just given how much they want to be with families, and yet how much they want to be with their own families when their own families, whether that's parenting an aging or caregiving for an aging parent or caring for their own school-age kids. Just really hard times. I'm sure you feel this in your own lives too. It's almost surreal how hard life is until you pause and reflect with a couple dozen women about it. So I will say we cut $5 million in expenses out of our organization in the month of April, $1 million in administration alone, massive layoffs, 200 people furloughed by the 3rd week of the epidemic. We've brought the lion's share of those folks back because of demand for services, right? Like our families haven't walked away. We're needing to be really creative to reach them, but massive revenue loss. So the organization kind of dealt with that revenue loss by making major cuts, and we will survive as a result. Just look at the leaders that Lisa and I get the privilege to work with. I mean, some of the bravest people I think around to make incredibly difficult decisions early on that had real impact on the lives of our staff. So it's been difficult. We're on our feet, but not without scars. So appreciate the question. I think we're going to be good at that. We're stronger for it, but it's been really difficult.
Maureen and Lisa, thank you very much. And I think, Maureen, I think you also shared with me that, didn't you end up having to shut down one of your locations as well? I think you told me St. Louis Park.
We did. We had about 13,000 square feet in the 2nd floor of the Bremer Bank building in St. Louis Park. We had 5 treatment rooms there, plus cubes for about 55 folks that work out in the community. We've absorbed that whole team back into Minnetonka, mostly, a little bit to the Harmon Center, but mostly to our Minnetonka campus, and absorbed all that treatment, mostly into telehealth services, just so we could save about $250,000 in the last year of our lease there. So it was another brutal move, but actually far easier than some of the staffing decisions that we've needed to make.
Absolutely.
It's far easier to cut out of a lease than to back out of a long-standing coworker relationship. So yeah, thank you for reminding me.
Absolutely. Well, thank you for the work that you do too, and thank you for sharing your story. So members and guests, any questions that you have for St. David's? You have to take yourself off of mute, please.
Maureen, can you be a essential worker? I'm sorry, Susan.
Oh,
I
go
should-
ahead.
I should let you go. Could you be an essential worker and open up? That's what I did after April. We stayed home for that 1 month. And then I said, we got to get back in. So we were only out for 30 days.
Yeah, I think our whole team is essential. It's just who we can afford to employ, Terry. It's a great question. And our other problem was we had 544 employees in 2019. So we didn't qualify for any of the federal relief where you had to be below 500 employees. So it just, you know, could you please tie my other hand behind my back? You know, it just has been difficult. We just got $385,000 in Medicaid provider relief in the month of August, and we're hoping for the second tranche of funding to come through here in the next month or so. But again, $5,385,000. So we're finding our way and hoping that with the community spread that we can just get through these next 6 months and have as many people stay well and as many people engage as possible.
Susan, did you have a question?
I do. It's for Lisa. Lisa, as I was listening to some of your statistics about outcomes, and you mentioned things that occurred during the time period, and one of the numbers you threw out was something about 81% of parents, I think it was something like improved. It was an improving kind of a statistic. If you would read that again. My question though is, tell us about the other 19%. What does that look like? What was the statistic about the 81%, first of all?
Yep. So 81% are demonstrating responsiveness and positive interactions with their children was the statement. And the other 19% are sometimes holding steady, and sometimes they needed preventative care, which our community doesn't provide any longer. We do intervention and not prevention. And so even at 3 and 4 and 5, the need is too high, and we'll refer to a hospitalization at a very, very young age to get their needs met in a different way.
Okay.
Did that answer your question,
I
Susan?
think so. I was really thinking the 81% applied more to the parents.
It does.
Is that right? So,
Yep.
so just say a little bit more about that other 19%. I realize you're saying that their needs are often greater than you all can provide. What
Yep.
kinds of needs are those, I guess, is what I'm wondering. A little more specific about what those issues are.
About what the parents need.
Yeah, for the 19%, what kinds of help do they need?
So the needs are so intense and so high for so many of our parents. So those other 19% might be, I mean, I have some clients in mind right now where they just received their children back from being in the foster care system. They don't have housing and they've got CD issues. And so we're worried about so many other kind of really basic safety needs that in order to respond to your child, you need to feel safe, you need to feel secure, you need to have a home, you need to be well fed. And so when all of those things are on shaky ground, parents just not able to respond to their kids in appropriate ways or even make that a focus of their life when all those other things are on unstable ground.
Got it. That gives me a context. Thank you.
Great. Yep.
Lisa, what percentage of your parents have learning disabilities?
I don't think we measure that, Terry, but my guess is between 50 and 75. From my experience, both doing direct service work, most of the parents we work with have been in special ed, which would indicate some kind of learning disability or something along the way, or a delay that wasn't
And it
addressed.
just
in special ed.
exacerbates the problem at home because they're not able to help their children either.
And if you've had a really negative experience with an education program, you're not going to feel excited about sending your child to school if you feel like you're going to be shamed. It's a vicious circle.
Go ahead, Shar.
I'm a former St. David employee. I retired in 2002 and was with the agency for many years. And I hear both the passion that you and Lisa and you have Maureen, and I know as a former staff person that still is carried with me from what I witnessed and the families that I was able to see and oftentimes indirectly be of support to. And one of my favorite things about St. David's was that we called it seamless services. When that family gets the diagnosis or, you know, with their child, they walk through the door and everybody was there to help them. They didn't have to be going all over town, and the support for the parents too. So I'm just there. I have some clocks that are going to go off here. I'm just grateful that you're continuing the wonderful work that you have. I know Scott Harmon very well. I was very saddened to hear of his death. He's just one of the finest young men I've ever met. And I'm just glad I'm part of Giving Women and that we've been able to help you to continue the work that needs to be done. And you too, Terry.
Shar, I was wondering how many other Shar Murphys are on the planet.
Yes. me
I
too.
love that I saw your name. Yeah, it's great to
I
connect
recognize your
tonight.
name too. Yeah.
All right, any additional questions for either Terry, Maureen, or Lisa?
I don't
I'm
have,
going to take,
but I just, Maureen, I want to say hello. I work for a company that has supported the St. David's mission for many, many, many years. So I'm so sad about how this has affected the organization.
Thanks, PK.
all right, any other questions? Go ahead, Pat.
Yep. So Terry, where do most of the referrals come for women who, you know, access your agency? I mean, do they come from law enforcement or social service agencies? You know, how do you find your people?
Beautiful question. About 10 years ago, it was from law enforcement because we used to have what was called a diversion program. We would work with the city of Minneapolis and St. Paul police departments, and they would refer women to us. And then after they completed 14 weeks of group, we'd rip up their warrants and there you go. But because now they don't arrest women or girls, period, which is not a law, but it's just a practice, we have to go out and find our folks. But a lot of it's word of mouth. So as many of you, all of you here probably understand that there's a huge intersectionality between drug addiction and sexual abuse, okay? So one of the things, we get a lot of referrals from treatment centers. We are now full-time in Minnesota Teen Challenge doing groups there because they've realized that there is a huge intersectionality, and unless you really process what's happened to you, not necessarily put a label on you, but process it, you're going to continue to do those drugs and try to dissociate. So on the streets, in the encampments, we still go down Lake Street, Pat. We still go down Bloomington Avenue and find those gals that are doing the street prostitution. We get some referrals from judges. We get some, I'm really good friends with John Choi, Pete Orput, Mr. Backstrom, all of our county attorneys. So that way, and then other service providers, because like for instance, maybe Pride. I work really closely with Lorena Pinto and the executive director at Pride, where we will send our LGBTQ folks there because they have special curriculum, but they don't have any housing. So they send their folks to us. So there's never, there's never a lull. And then quite frankly, a lot of us go through this program way more than one time. The average number of times it takes someone to leave their abuser if they're in domestic violence is 7 times. So you couple the trauma, the chemical dependency, and everything else, you know, it's, I would say, you know, it's about 12 times as the average person goes through treatment before they're sober. So it's somewhere in between there. We see our women, you know, way more than once. And sometimes the first time is just planting a seed, because you wouldn't believe it. Not everybody that comes here believes or even acknowledges they've been involved in prostitution. They'll say, oh, my cousin comes and we hook up. My cousin's friend will hook up once every 3 months and he'll pay my rent, but that's not prostitution. That's not, well, yes, it is. So we have a lot of different conversations with a lot of different people and get a lot of different referrals.
Thank you. Thank you.
Mhm.
All right, any additional questions? All right, then I think we need to give our speakers a quick applause. All right, thank you. Thank you so much to the three of you for spending part of your evening tonight and sharing your story. So we're just so thankful for you to be here. So as I wrap things up, let me just make a couple quick announcements here for our members. I want to remind you about our upcoming Eye Opener event. Kari, I'm sure wouldn't let me hang up if I didn't do this. It's scheduled for Saturday, November 14th. And our topic is women and incarceration. And we're very excited about some of the speakers that we have for that day. So we want to encourage you to come, and we want to make sure that you invite any guests for that event. The meeting is going to take place over Zoom. Unfortunately, we're not going to be at the Minnetonka Club this year. So please watch our newsletter for more information and also a link to the meeting on the 14th. As I mentioned, we do have some additional Gathering Women events planned. You will hear from more of our 2019 grantees. So please continue to watch our newsletter for that information as well. And of course, the E&E group would love any feedback that you have about the events that we are trying to host to keep this wonderful group of people together. So in the meantime, happy Halloween. Thank you for being here. Please stay safe and please stay healthy. And then we'll see you on November 14th. All right. Have a great evening, everyone.
All our thanks once again.
Thank you, everybody.
Thank you,
Thanks.
everyone.